If you are less than 6 weeks after delivery, whether cesarean section delivery or vaginal delivery, now listen very carefully. You are still a patient. You are still actively under medical care. And so you shouldn't be figuring things all by yourself alone on the internet and on the media. No. You should be asking any question pertaining to your health directly to your midwife or to your doctor. I say this because I see a lot of new moms keep asking questions like, what should I use to clean my wound? When should I remove my dressing? I'm 3 weeks after delivery and I'm still bleeding. What should I do? Is it normal? The thread is coming out 2 weeks after delivery. Should I remove it? Is it normal? You know, these things, when I see them, it worries me, honestly. I begin to ask myself, is it that these mothers were not initially under the care of a medical personnel? So no, my sister, you are not supposed to be coming to be asking us such questions, because the people you are asking are not your personal doctors. They can't even see your wound. They don't even know how your wound has been progressing. Let me make this clear to you. Childbirth does not end immediately the baby is taken out of you. No, it continues. In the first 6 weeks after delivery, your body is still healing. Internally, externally, your uterus is returning back. Bleeding is still ongoing and then reducing. Your stitches are healing. Your incisions are healing. Hormones are changing. This period is what is regarded as postpartum period, and it requires active medical care. It is not a period where you come online to be asking questions you are supposed to be directing to your doctor and to your midwives. So if you are coming online to ask strangers, irrespective of who the stranger is, about your wound, about your stitches, about your care, it simply means one thing. You know what? It means either you have missed your appointment, you are delaying your appointment, or you are underestimating your postpartum follow-up. And another thing I realize is this: once we are discharged, the concern is more on the child. On immunization day, circumcision day, we forget ourselves. No. Now, if you have cesarean section, you have vaginal delivery, this is the time your doctor will check your wound, will check your incision, will check your stitches, will check if you are healing well, if you are still bleeding, if the uterus has returned back, if there's any abnormal changes, abnormal vaginal discharge. This is the time the doctor looks at you holistically. And some people think that vaginal birth doesn't need any follow-up. No, whether vaginal or cesarean section delivery, they all need equal care, equal postpartum care. Now listen, do not pull out any thread you are seeing on your wound, on your body. Do not rub or apply any substance that wasn't prescribed by your doctor. Do not assume that this bleeding, especially heavy bleeding after delivery, that it is normal without being assessed. And also, please don't wait until the pain, until the problem becomes worse before you report to the hospital. And most importantly, do not rely on the advice of anyone you are seeing online on the internet who has no access to your body or to your wound. It's just a guesswork, and your body does not deserve guesswork. As a mom, we deserve proper healing, we deserve proper medical care, and not an experimental feed. All right. Another thing that is very important I need to say is this: please ensure you keep with your postpartum follow-up. Make sure you attend your postpartum follow-up visits. To some persons, they will give 2 weeks after discharge, some 4 weeks after discharge. Some people, it may be 2 weeks, 4 weeks, 6 weeks. It just depends on how closely you need to be monitored. All right, because no two individuals are the same. But there is no way you would not be given an appointment. And if you are not given an appointment, please schedule one, ask for one. Please, if you are being treated and you are not understanding, ask questions. It is your right. If you have been discharged home and you feel there is a need for your doctor to see you, don't wait until the problem becomes a masquerade before you start going back. Please go back for proper care. That doesn't mean that you are disturbing the healthcare provider. It doesn't mean that you don't have sins. It means that you need the best care after childbirth, irrespective of the outcome of the childbirth, please, because some people will just forget about themselves, especially when there is maybe a poor outcome of the delivery. No, you don't need to forget yourself. You don't need to just abandon yourself. You also, you equally deserve to be taken care of. Okay. So, my dear, if this message spoke to your heart, please do well to share with other new moms. You may just protect her from harms. This is Dr. Isi reminding you that delivery is not the end of postpartum care, but the beginning of recovery. All right, guys, I'll see you in the next video. Bye.